Good morning, everybody. I know that I've got a louder voice than David, so we're no microphone needed here. Like you said, I'm Christy Goody. I've been at the clinic for 12 years, 12 wonderful years. I wouldn't trade any of them for anything in the world. It's been, as he says, I've lived there basically. I've got a bedroom downstairs in the basement. And first off, I want to thank everybody for coming and supporting Madison Women's Clinic. I also want to thank Dr. Arad and Dr. Evans for sponsoring this and bringing it to our community and wanting us to be aware and wanting us to have it out there to benefit our lives and make our lifestyle a healthier one and a happier one. Like he said, my topic today is on preventative health care, and if I pass out, I've got a lot of medical students in here, medical personnel in here that can CPR me back here. But like you said, it's preventative health care, the why and the how. We're going to start right at the beginning. We're going to start, and I'm going to give you a lot of indications of what's out there to prevent health and long-term illnesses. So we'll start with adolescent and teens. In the adolescent and teens, they start right at birth. Of course, we're in the baby business, so we know that up at the hospital they start early to prevent. There's immunizations up there that they start at 0 to 5 years of age. One of the things I really want to get out there is to know your practitioner, know your provider, get a relationship with your provider. Trust your provider because they're going to give you schedulings on all these immunizations that help prevent long-term illnesses and take care of you through your life. Like I said, 0 to 5 years of age, they have immunizations that they start. You want to stay on that schedule. Talk to your provider. At 5 years of age, they start saying that, go to the immunizations. They start saying that some of the things they say, flu vaccinations. My family just walked in, so yes, it just took my attention. Flu vaccinations is starting at the age of 2. Sometimes, depending on your provider, they start at the age of 5. It's a yearly recommendation to do a flu vaccination. There also is HPV. Does anybody know what HPV is? Human papillomavirus. I think everybody in Madison Clinic should. Gardasil. It's one of those that we start at the age of 11 and go to the age of 26. Tdap, starting at the age of 5 also. Tetanus, diphtheria, and pertussis. Now, a lot of the times there's been some misconceptions about these immunizations that are out there. Talk to your doctor. Get a good relationship with your provider. Because there's some misconceptions so that people aren't getting their immunizations. One of the things about immunizations is it's not just a preventative in your own self, but it's a preventative in the community and people around you. So make sure you stay on these series that are out there in the immunizations. Meningococcal vaccination. This is one of those that you don't hear much about, but parents, all of these start with us, as we've got to make sure that our children are taken care of. Meningococcal vaccination is college freshman age. We want to make sure that they get that and find out what it is. Ask your provider a little bit more about it. Hepatitis A and B. That's also one of those. These are all in series, so know your series. I want to hit a little bit on each one. In adolescence, this day and age, in adolescence to teen, it's starting earlier and earlier. Obesity, diabetes, elevated blood pressures, and elevated cholesterol. Now, through the day, each of our practitioners are going to hit up on something. So after me, you'll hear a lot more about obesity and weight and diet and exercise and the stuff that goes to this. But I want to hit up on obesity at our younger age because why? It's parents' responsibility to take care of their children. Teach them a happier and healthier lifestyle. One of the preventative ways of obesity is, of course, diet and exercise. And like I said, Dr. Alred will be hitting up on that quite a bit more. Body mass index. This is going to be one of those things that you will hear every time you go into your doctor's visits. They do recommend doctor's visits in adolescents to teens. on a yearly basis. It's a wellness visit. They monitor all these kinds of things, your body mass index, BMI, your weight, blood pressures, things like that. And make sure your children have their wellness exams starting at, gosh, I think the age of 2 weeks. Diabetes, again, obesity leads to diabetes. It's happening at a younger and younger age. So parents, live a happier and healthier lifestyle. Do diet and exercise. I don't know of a 2-year-old who can go and get him a peanut butter and jelly sandwich. So that is our parents, our responsibility. As we get into diabetes, I want to go back one more time. As we get into diabetes, this is one of those things that we know a lot about as we get into our pregnancies, and I think Becky's going to hit much more up on planning pregnancies and healthier pregnancies, but all of these lead to a higher risk in pregnancy. Blood pressure monitoring. They do it, even with little ones, they do it starting at their wellness, age 5. I do know that age appropriate, and it's one of those things that if it's necessary to do earlier, then of course your provider will do that. Also, I want to go back a little bit because there's one thing that once obesity hits, you've got diabetes issues. It goes into blood pressure issues, and it also goes into, of course, cholesterol issues at a younger age, and we see it. It happens more and more. The last one on this day and age is blood pressure, and the next one, of course, is dental. Blood pressure in adolescence is book normal is 120/80. That's not necessarily normal for everybody. Youth, adolescent to teenage, it's less. It's normal to be less at 120/80. But know your blood pressure. In our office, I can't tell you how many times we do blood pressures a day. I don't know if I've even hit one patient on a daily basis at 120/80. Everybody's individual. Everybody's different. So know your blood pressure because you monitor your blood pressure from where your blood pressure is at. Now dental, starting at the age of 2, they say to have yearly exams with your dentist. Know your dentist because every situation is different, but they do recommend it at the age of 2 to start getting, when their teeth come in, to start getting to know your dentist. Bad dental care leads to heart disease. Then we jump over to 20 to 30s. These are also known as our childbearing years. One of the things that we watch during these childbearing years, or 20 to 30, you always start your exams at the age of 20. Physical exams, sometimes pap smears, depending on sexual activity. Sometimes you'll want to start sooner. Know your provider. Talk to your provider if you'll need an exam sooner. But recommendations, I'm going to go over some of these things. Recommendations to 20 to 30 is, of course, 21 years of age to start your exams. Physical, we're going to go over some of these things, and you'll hear a lot more of these things in depth as we go. The BMI. Self-breast exams on a monthly basis. Clinical breast exams yearly. Pap smears, again, at the age of 20, or with sexual activity. Like I said, frequency, consult your doctor. In a pap smears are cancer screening. They start at 21 years of age unless you're sexually active and unless your doctor suggests frequency. One thing about this, always know your own family health, your family history, because all of this can play in parts of how you want to be seen and how you want to present yourself, of course, to your practitioner. They recommend it every 2 years, but like I said, always consult with your physician. And again, it's a cancer screening. Breast exams. This is one of the most important things in not only men but women too, but women as well, or men as well. They recommend self-breast exams, and if you're not familiar with how to do it, ask a practitioner, ask a provider to show you. They're all willing to explain on how to do it and what you're looking for. When you do your own self-breast exam, you're looking for changes, not necessarily, I've heard this a million times when women ask, yeah, but all breasts are lumpy. Yeah, they all are. The doctor wants you to be familiar with your own body and familiar with your own breast. No changes. If you feel changes, then you'll definitely want to contact your provider and further do some testing and consult with them. At the ages of 20, you'll start doing clinical breast exams. They recommend these exams on a yearly basis or bi-yearly, depending on what your doctor says. And also, like I said, know your family history. Like I said, the BRCA and the Gale model, know your family history. Those are in depth. Those are things that you'll just, if you've got family history of breast exam, talk to your doctor. Okay, immunizations in pregnancy. They now are recommending that even though Tdaps are recommended every 10 years, they're recommending in pregnancy that you do a Tdap. That's a tetanus, pertussis, and diphtheria. You do that every pregnancy, whether you have a yearly pregnancy or every other year. No matter how many pregnancies, how often and how many pregnancies, they want you to do that. Immunize yourself. There's others out there. We do blood tests during pregnancies that give us indication on if you've been immune and you're not immune to your immunizations. There are indications that you'll discuss that you'll need more immunizations. Also during that, a flu shot is highly recommended during pregnancy, every pregnancy. This is one of those things that we see more and more, and I guess maybe it's because, of course, we're in a women's clinic. But it doesn't only hit women, it hits children. It hits youth, younger and younger, it hits men. So be aware of your own health. Be aware, our best indicators are our spouses or our children. Be aware that there are things out there, especially during hormonal changes and especially during all the changes that we do from adolescent to beyond, that help us monitor our good health, emotional, mental, physical, and these are some of those things that not just emotionally and mentally, but it does cause physical illness. So providers are willing to talk. One of the things that we always watch for is, of course, postpartum depression, anxiety, things like that with hormonal changes. So consult your doctor, have a good relationship. This is one of the bigger things. And one thing about it, it's really individual. This is something that is very individual. It's between you and your practitioner. And if you feel you have a problem and you want to discuss this with your practitioner, don't feel like it's something that you can't or you have to discuss with some other member of your family or something. This is an individual thing. We want you to have good health. Then we jump to the 40 plus. As you see, the list gets longer. We're all happy. 40 plus. This is some of the things that you see after childbearing years and after hormonal fluctuations and after child weight gain and all this kind of stuff. You see a lot more issues. They recommend to see your doctor, like I said, on a yearly basis, or it's personally between you and your doctor. Some say every 2 years, some say every year, depending on your health and on your health history. Blood pressure is something that you always want to monitor. It goes up with age sometimes, depending on if you go through a little bit more weight gain or a little bit more stress in your life. This is something that there's a blood pressure cuff at every grocery store around here. There is a doctor's office that you can even own your own blood pressure cuff. So be familiar, know your family history too. This is something that's really important that that'll carry through for the rest for your life, and it will deplete your life quality if you don't monitor that, and it sneaks up on you sometimes. High cholesterol, family history. Also, it's how you live. It's your lifestyle. This can be one of those silent things. A lot of the times, you go into the doctor's office, and at the age of 35, they're recommending blood tests to watch this. Usually it's at 35, but if you don't have a family history, they can go to 40, and it's recommended to do it every 5 years. This is just as simple as a blood test. Some doctors like you to come in fasting. They say it's more accurate, but if we can get you into the doctor's office, and it might be every 10 years, we don't care if you're fasting or not. The doctors can calculate. We just want to get your cholesterol checked, because some women don't like to see the doctors, some men definitely don't like to see the doctors. But if it can't be controlled by diet and exercise, this is one of those things that there are pills, there are medications out there under a doctor's care. They watch you carefully, and it depends. You might have a lot more blood testing and monitoring until they can get it under control. And again, diet and exercise really aids with these medications to benefit your lifestyle. At the age of 40 plus, physical exams and pelvic exams. It depends on your personal history, depends on hormonal fluctuation, it depends on surgical. If you've had a complete hysterectomy, you'll definitely want to consult with your doctor. Some people get the idea that if, I've had a hysterectomy, I don't ever have them again. Yes, you do. They're highly recommended, not only because we want to see your gorgeous faces, but we also want to make sure that your medications, if you're on daily medications, you get those monitored. Your blood pressure is monitored. You do clinical breast exams. You are doing your self-breast exams. At the age of 40, you start mammograms. And mammograms are right now recommended on a yearly basis at the age of 40. Unless your family history and your doctor, your provider, gives you other indications. At the age of 40, your doctors might start talking about what we call bone density, or BMDs. This is something that they'll start talking about depending on your family history, medication, self-history, like surgeries, hysterectomies, things like that. So that is something that they'll start talking about, but usually bone scans are going to be talked about a little bit more on at 50 and every other year, and colon cancer and incontinence. Now, when we talk about blood pressure, colon cancer, and all these, this is mammograms. I know I'm really confused. That's okay, because I was going down the list. Like here it says, annual mammograms, 40 years of age. This is really important to you women. Please stay on top of those. Hormone imbalance. We've got Rochelle Jones, one of our nurse practitioners. You're going to hit up on this a lot more. But always we deal with a lot of this, not just women in our office, but we do a lot of hormonal imbalance with men. It's a problem. When men don't realize they have hormonal imbalances just as much as us women. Once you're depleted, once your hormones deplete, they don't go anywhere. Look for signs and symptoms of hormonal imbalance. One of the things are you think, oh, I'm just tired. And that is one of the things that I know Dr. Ara is going to hit up on a big time later, fatigue. You just think, oh, it's just the daily rigmarole, I'm just tired. There's blood tests out there that we can monitor, and we can look at your levels. So ask your practitioner, be aware of your hormone imbalance, because it just does, it depletes quality of life. Again, bone scans. We do start them, like I was saying. We talk about them at the age of 40, depending on on your personal health. You also can maybe hear them as a DEXA scan. This is a postmenopausal, not only that, a premenopausal, not only that, it's also if you've had certain surgeries, and medications can determine osteopenia, osteoporosis. Be aware of those words because they're out there, and again, family history. Know your family history because it has a big play in all of this. That speaks everything right there. Colonoscopies. They suggest them at the age of 50, and they say it's recommended every 10 years. Sometimes it's recommended differently. I will say I've already had one. It's not as bad as you guys think. It's a little freaky when you hear about it, but it's a lifesaver. So definitely discuss it with your practitioner. Trust your practitioner. I've seen it save lives. I've heard it save lives, and I've also, if this is not watched, it's also a deadly silence disease, incontinence. I think every woman has it. Dr. Evans will be hitting up on this big time, a lot later. This is something women, well, all of us go through. You've had children. History, it's just your anatomy. Sometimes your anatomy is just built that way. You can't do a darn thing about it. There's 2 different types that we look at, but there are testing, stress and urgent. There's testing that we do at the office. It's called a CMG or a cystometrogram. This is something that we can determine what type of incontinence, and we can also, it tells us what we can do, from just self-exercises to surgery. So ask your doctor. Don't be afraid to ask your practitioners about these tests that are out there, because quality of life is the most important thing. Healthy, happy living, healthy exercise, healthy diet, good relationship with your doctor. You guys, these are all the most important things. And I know I went through a lot of it fast. That's why we have really better speakers after this, because they are going to get into this in depth and they know what they're talking about. So if you didn't catch what I said, I know it was up here on the screen. Write it down. Have a good relationship with your doctor, and know that your doctor is out there. They put on this health fair. They know, they care. They went into the health care profession to help. That's just the type of people that we have here in the office at Madison Women's Clinic. So thank you guys, and enjoy the rest of it, okay? I rambled. Thank you.